Our pathogen presentation on rubella and sporotrichosis. Our rubella pathogen. Rubella is a mild viral infection of the respiratory tract. Rubella is commonly known as German measles, and the causative agent is the rubella virus. The rubella virus is the only species in the genus Rubivirus and family Matonaviridae. Transmission of rubella is direct contact or respiratory droplets from infected persons. Coughing and sneezing are often symptoms. An infected individual is typically contagious 8 days before and after the onset of the rash. The physical description of rubella. Rubella virus is roughly round in shape with an approximate diameter of 60 to 70 nanometers. It contains an envelope and has positive stranded RNA. The capsid shape is pleomorphic, meaning that it can take the form of many shapes. This virus also has 2 envelope glycoproteins that project from the surface to make spikes. Signs and symptoms of rubella. It spreads via respiratory droplets and direct contact. Low-grade fever, a pink or red rash, and swollen lymph nodes are often symptoms. Joint pain, mild conjunctivitis, and cold symptoms. Treatment and prevention of rubella. It often resolves on its own within a week. Some risks are CRS, encephalitis, and thrombocytopenia. There's no specific antiviral treatment. However, symptom relief with acetaminophen, which reduces fever and joint pain. Acetaminophen is a pain reliever and a fever reducer. Some vaccines also help rubella. Preventative treatment hygiene, which is hand washing, avoiding shared items, and covering your mouth and nose, are often preventative treatments.
The historical prevalence of rubella is that in 1969 in the United States, the rubella vaccine was not licensed and rubella was common in children and with the highest number of cases in the spring. Epidemics occurred often, about every 6 to 9 years. After the vaccine was used, rubella was eliminated from the United States in 2004, and less than 10 incidences have been reported since annually. About 47,000 rubella cases occurred each year in the U.S. in the 20th century, compared to only 3 cases in 2023 with the vaccination implementation. It is most commonly impacted with children and people in Nigeria, Chad, and India.
Sporotrichosis is a fungal disease that targets the skin. The fungus is found in soil and plants in the United States, with a different strain being more prevalent in South America, spreading from cats to humans. Sporotrix shrinki is a fungus that lives in both plants and soil and causes sporotrichosis, which is a fungal skin disease. It's spread through direct contact with infected plants, often through open wounds. It can be spread by getting pricked by a thorn bush, which is how it got its name, rose gardener's disease. Sporotrichosis is caused by Sporotrix shrinki, which is a dimorphic fungus which has different forms based on the environment it's in, caused by temperature. So when it's at body temperature at 37 degrees C, it's a yeast and is a creamy tan color and has a round oval shape that can have diameters up to 2 to 6 micrometers. The buds are sometimes shaped like a cigar, which is how they are distinguished, and you can see that in the image in the bottom right. The yeast form has a cell wall surrounding the plasma membrane that contains granules of melanin and other proteins that help adherence, which increases the fungal virulence. This fungus also contains DNA and is gram-positive. When it's at a cooler temperature of 25 degrees Celsius, it's more of a mold form. So it has a filamentous form composed of hyaline, cephate hyphae that are 1 to 2 micrometers wide. It often has brown thick-walled canadia, which are asexual, non-motile spores. And these arise beside the hyphae. That's how you can distinguish this with the dark walled canadia. Signs and symptoms of sporotrichosis. It's transmitted through skin contact contaminated by plants and soils. It's commonly acquired with cuts or thorn pricks. It often has painless skin nodules and may ulcerate and ooze. It can also spread to lymph nodes, lungs, bones, and CNS in immunocompromised individuals. So treatment and prevention of sporotrichosis. It can become chronic if not treated and have more extensive lesions. The systematic spread in immunocompromised individuals. It's treated with oral itraconazole and cytosurgery for keratotic lesions, which is safe for pregnancy. Wear protective clothing and while handling soil, hay, and plants to reduce transmission.
The historical prevalence of sporotrichosis is an estimated of 1,471 sporotrichosis hospitalizations occurred between 2000 to 2013 in the U.S. During 1980 and 1982, an annual evidence of 2.4 people out of 1 million people were reported to have it. An estimated annual incidence rate in 2013 was 0.35 hospitalizations over 1 million people. The number reduced in between these decades due to awareness of sporotrichosis, prevention methods like wearing long sleeves and protective gloves while gardening. Sporotrichosis does not have a specific area where it is more impacted than others because it is reflected in outdoor occupations and activities, but it is more common in men between the ages of 18 to 64. Interesting facts about rubella are that women who are pregnant or 4 weeks before getting pregnant should not receive the MMR vaccine because it contains a live weakened virus, and it is different from measles because it comes from a different virus. Interesting facts about sporotrichosis is that the South American species S. brasiliensis spreads cat to human, and diagnosis may require microscopic skin analysis or blood tests for insufficient skin forms.
So some questions we have. How long are you considered contagious when you have contracted rubella? How can you prevent yourself from contracting sporotrichosis? What are things you can do to help with symptoms experienced with rubella? Does sporotrichosis live in plants, fungi, or both? If you have a red rash, is that sporotrichosis or rubella? Does sporotrichosis or rubella have 2 envelope glycoproteins? And then here's our references. Have a great day. And then here's our references. Have a great day.